Okay, so the sepsis 2026 guidelines are out now, and many of you must have read them, and many must have you have gone through the executive summaries like that. And there are various AI generated summaries also in that. We also made it and uploaded it. But my suggestion is you should read the whole document. It is somewhere around 70-80 pages, but you need to read around 60-65 pages. Why I'm saying that, when you go through these summaries, like 5 years later down the line from 2021 to 2026, now the guidelines have come. And behind any recommendation, there are 129 statements. So behind any recommendation or any suggestion, they have used the logic. What is the rationale behind that? What was the evidence? And when you understand that, you are better at the bedside when you're treating the patient. So I'll give an example, like how much fluid resuscitation fluid should be given in septic shock. So they recommend that now within 3 hours 30 ml per kg body weight needs to be given. Why? Because they have seen that in many trials which told that this is not the strategy. In those trials also, they have given this fluid and then considered liberal versus restricted fluid therapy. So if the patient receives less than 1.6 liter of fluid or more than 6.1 liter of fluid, these were the patients who were having high mortality. But within that range, which is 30 ml per kg body weight, if 70 kg person comes, so it somewhere turns out to be 2.1 liter. So these patients have a little reduced mortality sort of thing. So this needs to be given. There is evidence for that. Now, which weight needs to be calculated when we are talking about the 30 ml per kg body weight? So if the body mass index is less than 30, then the actual body weight should be used. What is the weight of the patient? We need to use it. But if the patient is obese, then if you take the actual weight, then the chances of miscalculation and more fluid given will be more. So in body mass index patient who have a BMI more than 30, you should use either ideal body weight or adjusted body weight, so that the fluid resuscitation does not make the patient in fluid overload. So they have given a beautiful table based on the height and weight in that category. So in the recommendation, you will only see that 30 ml per kg body weight needs to be given. But why it is recommended? What are the benefits? Which needs to be used? Which weight to be used? This is important. So 30 ml per kg body weight if the BMI is less than 30 actual body weight. If the BMI is more than 30, then you should use the ideal body weight or adjusted body weight. So I hope you will read these guidelines in detail. And if you want, I can read with you in a session. We'll go through the PDF. Do let me know in the comments. Thank you.